Over the past couple of years, few Republicans who want to repeal the Affordable Care Act have taken time to tell us what they might propose in its place. Yet one who has is North Carolina's senior senator, Richard Burr. Tonight we're on the record with details of what the senator has labeled the Patient Care Act.
It's time to go on the record with WRAL News.
The Affordable Care Act is now law, upheld by the U.S. Supreme Court. Even so, sailing for this new law has been anything but smooth. The rollout was a fiasco. So much so, the president has asked for changes and delays in the law and its implications. In the coming months, however, millions have signed up for health care many of them did not have in the past. North Carolina is consistently in the top states with the number per capita of enrollees. Still, Senator Richard Burr thinks there is a better way, and he is with us tonight to talk the specifics and the response he's received in support and against. And also with us, WRAL's Renee Chu has reported extensively on the ACA, or as it's commonly called, Obamacare. Senator, thanks for coming in, taking time to talk about this.
Great to be here, Dave.
This is a complicated option to replace the Affordable Care Act. Is there anything about the existing law you would want to keep in place?
Oh, clearly there is, because in the alternative that we proposed, we want to keep kids able to stay on their parents' insurance till they're 26. Makes all the sense in the world to have that healthy population insured under their parents' plan. We want to make sure that pre-exemptions, that pre-existing disease is not something that knocks you out of the insurance market. But we also believe that we've got to reform health care. We can't just go back to where we were. That was unsustainable. And that the main focus of health care reform should be cost, because cost is what makes health care prohibitive for many Americans. So we've focused on our alternative at creating a competitive marketplace by empowering individuals to be in charge of constructing their health care and challenging the insurance market to create more products, not less products, where government says we want one size to fit all. We want multiple plans that offer different benefit packages where people can pick and choose.
Is there a way to take what you are proposing and meld that into the existing plan without a total repeal?
I think it's probably impossible. And we've looked over the last year and a half, Tom Coburn and I, very seriously about how it could be tweaked. And it's difficult because of the government dominance that's in the structure of the Affordable Care Act. If, in fact, you could tweak it, it would probably be too much pressure from a standpoint of the taxes that are imposed in the Affordable Care Act that have yet to kick in. And more importantly, the richness of the benefit that we've provided for everybody is the reason that we've seen an escalation of 41% in premium cost with its introduction, where the president had promised a $2,500 reduction in people's premium cost.
Senator, the plan that you're proposing would do away with the health exchanges. What kind of incentive would you have for people to sign up for affordable health insurance?
Well, let me say, what we do away with is the federal exchange. I still think, I think state exchanges are great tools. Okay. And I would hope that if a state did it, they had the full power to construct their exchange and to run the exchange. That's not the case today. Even under the state exchanges, they were under the federal guidelines as to how they had to be constructed, the products that they had to sell, and how they operated. So state exchanges can bring great competition to the marketplace. From a standpoint of the cost, we believe that if you don't address the cost of health care, then you really have a product that's still financially unsustainable for most Americans. And we believe that expanding coverage by every independent analysis, we cover at least as many lives as the Affordable Care Act, and potentially much greater numbers.
But in talking with many North Carolinians, they want to know, how is this health care law going to affect me? What will health insurance cost for me? And will your plan provide subsidies for these North Carolinians?
What we do is we target individuals at 300% of poverty and below. And based upon their age and their income, there's a sliding scale of tax credits. That tax credit goes well over $3,000 for older and less income individuals. And that allows them to go into the marketplace and use that money to access their premium. We do something rather unique. We start the reform of Medicaid, where we empower states, without the federal government signing off on it, to change their Medicaid program. So it's conceivable that you could have a Medicaid program in North Carolina where a Medicare beneficiary could choose to take the tax credit and buy private insurance and be in the private sector pool where they get to see 100% of the doctors, 100% of the hospitals, not limited to the 40% that Medicaid currently has. And a state like North Carolina may see it advantageous to add $1,000 of state money to it to buy increased coverage or to buy down deductibles that might be in the insurance plan. The one big challenge for the Affordable Care Act is you bring more people in, is that for the first time people have these huge deductibles. And most Americans aren't used to that. We've gotten used to a $20 copay or $20% co-insurance. But in many cases, people have plans now that are $5,000 deductible before your insurance ever kicks in. I'm not sure how that benefits a low-income individual who now all of a sudden has health care, but as a family has $3,000 worth of deductible to pay first.
Senator, when a ship the size of the Affordable Care Act has sailed, and this one has at least pulled out of the dock, there's been some big waves along the way, but it's out there. How tough is it to turn it around, to bring it back? I mean, to repeal something that is in existence. It's not unheard of, but it's an uphill battle.
David, it's not impossible to repeal it and to move to something different. It is impossible to do it without damage to the system that's already been done. In other words, I believe that there's been some structural damage done to health care in America. Yesterday, the 4th community hospital in Georgia closed. The result of the Affordable Care Act. It will be tough to reopen those facilities. So as you see the infrastructure begin to crumble because of the Affordable Care Act, there's no reform that replaces that. You have to have a new starting point. And I think that we're still in a situation in this country that we've got the greatest health care in the world. As long as we've got the talent out there, then we've got options.
Okay, we'll take a break. We come back, we'll continue our discussion with North Carolina's senior Senator Richard Burr. We're on the record tonight talking with North Carolina Senator Richard Burr about his proposal to repeal the Affordable Care Act and replace it with his plan that is called the Patient's Choice Act. I think I misidentified that earlier on, Patient's Choice Act. And also with us is Renee Chu from WRAL News, who has reported extensively on the act that many people refer to as Obamacare. You were mentioning during the break that as a member of Congress, you had to go on through the exchange for your health plan, something different than you had done in the past.
Absolutely. I had to go on to the D.C. Health Exchange.
How was that? I mean, did you have trouble navigating that site?
Listen, you understand how difficult it is for the American people to go in and, one, find something that's affordable, two, find something that covers the entirety of their family. In my case, I was looking at how do I get health care in North Carolina being on a D.C. exchange. And what you find is you find an array of products, but finding out the detail of what each one is and when a deductible kicks in and what's not under the deductible, it's a challenging thing for the American people. And I understand what folks who have not had insurance before, who are now going into the exchanges, how difficult it is to understand exactly how it impacts them.
Technical glitches aside, though, it is the first time that anyone can shop for health insurance in that way, where you're able to compare plans side by side. I mean, this is part of that transparency under Obamacare.
It certainly is, but I think that it's difficult to understand that people who have accessed health care through the emergency room don't understand the rest of the infrastructure, don't understand the importance of a primary care physician, don't understand the benefit to the quality of life for themselves of wellness. And you can't get that unless you've got somebody with a medical home. And I think the Affordable Care Act was so well intended, but now, if in fact we have less access to doctors, even though we've got insured individuals, We fail at the fact that we can't get people in to do to access the wellness programs, the prevention that's needed. They still, in many cases, will be relegated to a different door that they enter in healthcare.
Senator, let's look out at the horizon and just for a moment say you were successful in repealing the Affordable Care Act and replacing it with your plan. What happens to those people who have already signed up under this plan, who didn't have insurance or were forced to change over the years? Would they be caught in some limbo land of not being taken care of while one plan would replace another?
David, I don't think so, but, you know, the unintended consequences mean that you will have some. We offer about the same subsidy from a standpoint of income level. Some would say our subsidy is not as lucrative. I would probably agree with them. But we're looking at a totally revamped insurance market. Therefore, every independent analysis has been done. Premium cost comes down. We save $1 trillion based upon the only actuarial work that's been done on our plan over the Affordable Care Act. We eliminate 12 different taxes. When you eliminate a 1.5% tax on medical devices, you're now bringing down the cost of health care. When you eliminate a 3% tax on health insurance premiums, you're now bringing down everybody's health care cost. So we have an effect of cost reductions in areas that really don't have anything to do with the delivery of care, but they were chosen to be funding mechanisms for the subsidy under the Affordable Care Act.
Senator, I read that your plan does eliminate the corporate taxes that the Obamacare Act had imposed on these different companies to try and pay for the Affordable Care Act. But then let's talk about financing, because one thing that you have in your plan is a tax for employer-sponsored insurance. So we're talking about 56% of the people in this country with employer-sponsored insurance that could face a tax hike under your plan.
Very good point. But very few would feel the effects, because the way we wrote it is that it would be 65% average of the most expensive plan in that system. Mm-hmm. So you might take the CEO's plan, which might be a Cadillac plan. 65% of that means it probably wouldn't touch 90% of the employees. So there would be no tax impact on 90% of the employees. It may be 10% of the executives that are all under a similar Cadillac plan would only receive the pre-tax benefit on 65%, and 35% would be effectively a pass-through of income. This is not different than the Cadillac tax that the president's got on an Affordable Care Act. It's targeted to make sure that people don't buy their way out of skin in the game. Most of the Cadillac plans mean I don't have a deductible. I can go see anybody anytime. That's not a good plan for the system. What we want to make sure is that people are adequately covered, but everybody has some skin in the game, a copayment, a deductible. We want to make sure that the insurers have the ability to provide incentives for people to use generic drugs versus name drugs, if that fills their health needs. We've seen trumpeted lately an overall reduction in healthcare cost. Well, a lot of that's come from blockbuster drugs going off of patent. It's gone from our choice of taking generics versus name brand. That shows that we need more participation by the American people, not less. And I think we'll see a similar situation as it relates to our alternative.
Senator, you are in the minority party in the United States Senate right now. There's a Democratic president. Are you Don Quixote tilting at windmills in this? I mean, it is, what's the reality? What are the odds of reality that what you want to do could happen? And if they are significantly low, are you doing this more to raise the awareness, to raise the questions about how changes could be made to the existing law, more than having it repealed and replaced?
David, I couldn't handicap very high the likelihood that over the next 3 years the president would sign a repeal bill and a reform bill. I continue to watch the president take the existing law and by executive order say, well, it's not going to apply this year, we're going to push it out. Why? It's because the president realizes this doesn't work. and he doesn't want to roll it out to big and small businesses. But he's put competition in a very difficult place. He's going to have companies that are 50 to 99 employees who are competitors with companies that are 100 or over. And healthcare is going to apply to one company, but not apply to another one. For Walmart alone, they announced this year that the Affordable Care Act is going to cost Walmart $330 million this next year in additional costs. So to say that competition isn't affected by the Affordable Care Act is just a dream.
Have you heard from the White House about your plan?
We heard from them about within an hour of introduction, where they trashed the plan from front to back. And then the president stood up at the State of the Union the next night and said, if you've got a great idea that brings down costs, come see me. I've got a phone and a pen. Listen, you had it right earlier when you said the Patients' Care Act, because that is the current one. Patients' Choice was what we introduced in 2009 when we were debating the Affordable Care Act. And the White House chose not to even entertain many of the things that were in the Patients' Choice Act.
A lot of work remains to be done. Senator Burr, we appreciate your time to come in and begin this discussion at length, and we will be in touch with you as we continue to see this unfold with the discussion, but thanks for being